Hi everyone, it's Dr. Morris with Magnolia Medical Center and MagMed TV. Today we're going to get the whiteboard out and I'm going to do a short drawing for you using my amazing artistic skills. If you've seen my other videos, you know they're not so amazing, but we're going to do a short video on what are the effects of birth control on your thyroid. So there's so many people out there suffering with thyroid issues or symptoms of thyroid. If you know what those are, brittle nails, brittle hair, hair falling out, tired all the time, you're just exhausted, constipation, just a horrible way to live. And people are suffering with these thyroid problems or what seem like thyroid problems. And this is people that are getting younger and younger and younger. We're seeing these issues in teenagers now. So what are the effects of birth control on the thyroid? So birth control pills on the thyroid. So we're going to break right here. We're going to come back and I'm going to do this drawing for you and hopefully I'll give you some insight on what are the effects of birth control on the thyroid. Okay, so this is how birth control can affect the function of your thyroid or the expression of your thyroid hormone. So you have a thyroid gland, sits in your neck, butterfly-shaped gland, sits right here, and it puts out T4, which is your most prevalent thyroid hormone, and T3. About 93% of it is T4. About 7% is T3. Now, just like any hormone in your body, the hormones cannot travel through your bloodstream without being attached to a protein. They have to be bound to a protein in order to flow through your bloodstream so they can get to the target tissue, where at that point, the protein releases that hormone so that it can go to that cell, and that cell then can receive that information and do what it needs to do with that hormone. But they don't travel in what's called their free fraction form through the bloodstream. They have to be bound to a protein. So in the thyroid's case, it is something called thyroid binding globulin, or TBG. Okay, so T4 gets attached to this binding globulin where it gets run through your bloodstream and it goes to the target tissues. Mostly it goes to the liver and the kidney, where it can be converted into the usable form of the hormone, which is T3, but that's for another day. Estrogen from birth control is the #1 medication that affects the number of these binding globulins. All right, so estrogens, those women out there, those women who are out there watching this right now who are taking birth control pills, they contain estrogen, which they all do. All right, synthetic estrogens affects the number of these binding globulins. So what does that mean? It increases the number of these binding globulins. Estrogen does, from birth control. It increases the number of these binding globulins. What that means is that the free fraction, free T4, is going to go down. The free form, the form that actually is utilized by the tissue, is utilized to convert into T3, goes down. So it can look like you have plenty of thyroid hormone. Your TSH might be fine, but you actually have, sorry, that's an H, but you actually have less of the free form utilized. So I'm not here to try to tell you which form of contraception to use. Maybe you're using birth control because you have heavy periods, or your doctor said he's put you on it to help regulate things because your hormones are all out of whack. You have to find the reason why your hormones are out of balance. Not do things that are going to mess up your whole system. So find birth control forms that are not going to change and alter your thyroid function. Folks, estrogen affects the number of your binding globulins, and when that occurs, the free fraction of the hormone is not going to be available for the tissues. It's not going to be available for use. So again, just to reiterate that, if you're on birth control pills and you're having thyroid symptoms, you may need to make changes to that. All right, so I hope you learned something from that. Folks, if you are suffering in your life with metabolic problems, you're not sure why you're tired all the time, you're not sure why you have constipation, you're just not sure why you feel the way you feel, you're not getting answers from your doctor, they say your labs are normal, you're getting the runaround, they've told you you're just depressed, you need antidepressant medications, folks, give us a call. We'll send you a link to our full-length thyroid or hormone videos. We have videos on that are condition specific. We can send you links to that so you can get yourself educated on what real information is on these problems. We would love to help. Our phone number is 615-225-9100. We have providers, the functional medicine providers, that are very, very good at these things. So give us a call. Again, the phone number is 615-225-9100. We always ask that you like this video, hit that little like button below, share it with your friends. You never know when something you share might be able to impact someone else's life. And please comment below. We'd love to see your comments. We'd love to know what's happening out there. And if there's any videos that you'd like us to do, any conditions that you'd like some information on, hit the comment button. Let us know, and we'll try to get some more information out to you. Folks, thanks for watching.